Morning, everybody. Thank you for joining our ACA Small Business Bootcamp and Resource Collective for this Tuesday morning, September 8th. I hope everybody had a good Labor Day weekend and was safe during their weekend. We're excited to be back on this again this Tuesday morning. I'm Robert Theobald, the Small Business Ombudsman and Vice President of Small Business Services here at the Arizona Commerce Authority. I want to start by first thanking our community partners. We could not do these boot camps without them. Their expertise, their content they've created, and their willingness to share has been extremely helpful. We could not do it without them. So as a reminder, the Small Business Bootcamp and Resource Collective is designed to help small businesses work through the COVID crisis and return stronger than ever. It is a statewide initiative supported by all of our community partners. And the boot camp is going to run through September and into October. We've been doing this boot camp since the beginning of April, and we have said all those sessions are recorded, and you can find those on our azcommerce.com Small Business Bootcamp website. All those sessions have also the materials that were with those sessions. Is also included on those links in the archive section on the website. It's the same page you used to register for this session. So you can find a ton of information there about the boot camp and previous sessions. Additionally, on that website, you can find our Small Business Resource Collective. And this collective are the resources that our community partners have provided to help support small businesses through this time, whether it's guides, tools, whatever they may be, you can find them on there. This is a list of some of those guides and resources that you'll find. There's an unemployment insurance guide. There's safe retail guidance for barbershops and cosmetologists. The national restaurant industry has a guide for restaurants, manufacturing, a ton of information. You can find that on there to help support your business. So a quick note about this week. Today is our Return Safe, Work Safe session with updates from the National Safety Council. We're excited to hear, review the safety issues and safety challenges and hear some of the updates that they've got. And then Thursday, our session is using data to grow your small business. And it's a first look at a brand new tool that the Arizona Public Service, APS, has developed and created called Size Up Arizona. We're really excited to partner with them on this session. It's going to be a great session. So if you've not registered for it, I would register for it and follow along. It's also going to teach you how to use the tool for your business. Some quick updates. If you're out in a rural community, we have our Empowering Rural Communities webinars. You can find those on our website, azcommerce.com/rural/economic-development-webinars. A couple times a month, those are shared, targeting specifics for the rural communities. Also, there's the COVID-19 Community Support Fund for Southern Arizona. That is an active grant program. You've got the link right there that covers Pima and Santa Cruz counties. The Maricopa County Small Business Grant Phase 2 is still active. And then there's also the Economic Injury Disaster Loan Program is still active and functioning. Quick note about the EIDL program is if you have applied for an EIDL loan and you haven't heard from the SBA, on their website there, at the bottom of the website, you can find their customer service number. Please give them a call and follow up on that. Don't wait around, but be proactive and make that call. We want to just a quick shout out for the ArizonaTogether.org website, which is the state's COVID-19 information and resources. And another reminder of our COVID-19 business resource webpage. This has information for workforce, financial resources, business resources, and other information related to businesses in Arizona during the COVID-19 pandemic. Great resource page to access. So I also want to share a quick reminder about the services that the Arizona Commerce Authority has for small businesses throughout Arizona. We have our Small Business Services Division, and we can help you with navigating through the SBA, working with the Small Business Development Centers, SCORE, working through local banking contacts and more. Additionally, our workforce division can work with you as a business owner, whether you're looking to hire employees or train or upskill employees. They have programs to help support employers. And then our Arizona MEP is the Manufacturing Extension Partnership, and they are focused on helping manufacturers grow and develop their programs from A to Z. They are an award-winning programs, so please take a look at them. Additionally, at this time, if you're looking to just start a business, to break free and start your own business as things are starting to pick back up, we have our small business checklist. And this is a tool that you can use to help with understanding the licensing and registration compliance requirements. It's an online interactive checklist that gives you some results to help you know where to go and who to contact to get your business started. So today we're excited to have Ed Tobby back with us. He's an instructor and trainer for the Arizona chapter of the National Safety Council. For those that have been following along in the boot camps, Ed was with us early on, provided a number of sessions on safety as we were working through the initial phases of COVID, and he's back with us today to share some updates. And so, Ed, I'm going to turn the time over to you and let you start your presentation.
All right, sounds good. I'm going to the share screen option here. Beginning. Here we go, hopefully. There it is. So good morning, everybody. Hope you had an awesome long weekend. My weekend was about 10 days long because I just got back from vacation as well. So I'm having to relearn everything this morning, so bear with me if I kind of stumble a little bit because I'm old and I don't remember stuff. But just want to introduce myself. My name is Ed Tobby. I'm a safety trainer for Arizona Chapter National Safety Council. And the primary courses I teach are first aid, CPR, train the trainer, and a number of defensive driving courses. But in addition, we do some lift truck training, some construction zone flagger, and some workplace safety certificate programs, safety training methods, principles of occupation safety and health, safety management techniques, incident investigation, ergonomics, team safety, job safety analysis. So it's a pretty long list of things we do. And joining me today is also Amber Pappas, President of Safety Help Today. Amber, take a second to introduce yourself.
Yes, thank you for having me back. I always appreciate the opportunity. As Ed mentioned, I too am a trainer at the Arizona Chapter National Safety Council. I assist with some of their advanced safety certificate programs. I am also the president of Safety Help Today. We work with small businesses on the OSHA compliance side of things, whether you have no safety program or kind of, are trying to get it figured out. We kind of come alongside in regards to the OSHA compliance and assist in various ways through policies, trainings, programs, that kind of stuff. But again, I appreciate the opportunity to be here. Thank you, Ed.
Awesome. As you can tell, Amber's the smart one of the bunch, but that's all good. Hey, just want to remind everybody, please use the Q&A function if you have any questions. Amber and I will be monitoring that throughout the course. We may choose to answer some as we go along, or we may save them to the end, but like I say, Q&A function, please use that. And at the end, you'll also receive access to the slides from the presentation. So don't be overly concerned with taking a bunch of notes. Just kind of relax and take it all in. So we do have some goals, and I'll acknowledge at this point as well, some businesses have been back for some time now. But there are others like movie theaters, bars, and others that just recently were able to reopen. So this particular presentation was designed primarily to help business owners come back from the COVID shutdown that happened initially, and what kind of things you need to think about as you reopen your business, as you build confidence with your employees, build confidence with your customers, talk about some medical testing, what you can do legally, what you have to be careful of, how to communicate your commitments to safety and health. And this, we're also going to talk about some lessons learned that we've added to the presentation that we didn't originally have. So what we've done is we've kind of combined things into a list of action items. And these action items are going to apply whether you've been back for 2 or 3 months or you're just now coming back, because they're still important things. And what we want to do as we kind of go through there, the presentation today, is kind of reflect, if you've been back for a little while, think about some of the controls you put in place initially. Are you still using those? Did you modify them? Were they effective? Those kind of things. And then, because what we want to do is kind of find that sweet spot where we're opening and being as efficient as possible, but still providing the level of protection that we need to continue to fight this virus that's not going to go away anytime soon. It's out there. And so we just have to find ways to mitigate our exposures to it and keep everybody safe. So we're going to go through these list of action items one at a time and kind of see where we're at. So the first thing we want to do is gather information and then form a task force and assign a leader within your company that's going to help guide everybody through this process. And it's important to gather information that is from reliable sources and credible sources. As we all know, when you look at social media, there's a huge spectrum of stuff that's out there with information that's good and information that's a lot of conspiracy theorists and stuff that, you know, is really outside of the mainstream of thinking. So we want to focus on the credible sources and use that information the best we can. It's also appropriate, and we encourage you to network with other business owners that you know and share the best practices. Hey, this worked for me. You might want to try that. Oh, really? You did this? Okay, hey, maybe I'll try that. So kind of go through and figure out what are the best practices and help each other, because we're all in this together. We need to build each other up. We're not competing. We're all trying to do the best we can to get through this crisis. It's important to have participation from all levels of your business when you have this group of people or task force, because the people that are the frontline people that are doing the kind of day in and day out jobs have a different perspective than those that are in mid-level and upper level management. So we want to make sure we have good communication from all levels, seek that input from all levels, and that way you have a really well-rounded source of information that you can work with. So some of the information resources we recommend: CDC, OSHA, ADA.gov. It has to do with disability and ADA issues. And I also work for the National Safety Council, who formed a SAFER committee right after the COVID crisis started. We gathered professionals from all around the country and form this task force to start to work on recommendations for the workplace. And these are anything from Fortune 500 companies to small businesses to people in the healthcare industry, the legal profession, government. They all join together for this cause of creating a database of information that everybody can access to help you manage the COVID crisis moving forward in your workplace. So this is kind of a description of this task force. I do have a link on the screen, and at the end we'll have a whole page of links that you can work with, and when you get the slides, those links will be there. But these SAFER playbooks are really, really helpful in that they've taken a number of different topics and different industry segments, and they've created, here's what you do in this particular case you're trying to address, and they have some very specific topics that they address. So I strongly urge you to visit nsc.org and look into their COVID task force, SAFER task force database. It can be really, really helpful for you. Also, I mentioned OSHA Resources. OSHA.gov has a great COVID, several pages and lots of links with standards, updates, a lot of medical information, some really good industry-specific guidelines. This is kind of like what the homepage looks like, and you see we're on the highlights, and then the right side, the medical information and control prevention. There's all these different links that you can go to. Now, I do have to say that OSHA has not developed specific standards for COVID. However, you do have an obligation under the general duty clause to have a safe work environment. So let me have Amber talk about that for just a second.
Yeah, and I want to chime in just a little bit on that. There is, I'm not quite sure when, but I just read the state of Virginia is actually pushing to get something launched fast, which in my opinion, that's the fastest I've ever seen a state react. Arizona hasn't mentioned passing anything, so we're still under the general duty clause, but simply put, federal and state OSHA have a clause kind of outside the regulations that indicates every employer must furnish a place of employment to their employees that are free from the potential or recognized harms that could cause injury or illness. So it's kind of that catch-all. So even though there is not a specific COVID-19 regulation that tells us what to do and how, all employers are subject to that general duty clause, and that's where this is all coming from. And so I love this OSHA's website. If you have not looked at this and the SAFER, tons of resources, but keep in mind, this is not regulation. All of this is just giving resources and recommendations based on employer type, in which OSHA says, hey, this is a good recommendation, but it is up to you, the employer, which I'll talk a little bit later about, to develop your own specific plans and practices to protect employee safety and health. And I want to throw that in there. A lot of people are asking, Amber, well, why is OSHA even dealing with this? Well, it is safety and health. It is not just falls and ladders and electrical. It is the health of your workers as well. So again, I don't necessarily see Arizona coming up with anything quickly, so like some of the other states are, but we still have to follow this general duty clause.
Awesome, Amber. Thank you for that. So our next action items, we want to do some risk assessment and some hazard analysis. So we want to look at our particular business, and we want to try to determine what is the risk. And I've got a couple of graphics of some different tools that are used in the industry to help not only identify the severity of the risk, or how strong it's going to be and what the consequences are going to be. And we also have some individual tools we can use to help identify specific tasks. So the chart on the left is if you have numbers associated to how likely something is to happen, 1 being rare, 5 almost certain, and then what the consequences would be if that was to take place, all the way from minor to catastrophic. So when you combine those two numbers together, let's say if you have a 4 under likely and 4 under the major consequences, you multiply those together and you have an extreme case of 16. And so when we have numbers that fall into those red and orange and yellow categories, we need to think about what we're going to do to mitigate those particular risks, so that we're not going to have these catastrophic consequences if there is an exposure. OSHA came up with a risk pyramid, and they have a document 3993 that is specific to COVID-19. I would encourage you to Google that, because it has some definitions that are associated with each of these different levels of risk. And it describes some of it in relation directly to businesses. But one way to help define what the risks are and what the hazards are is what's called a job safety or job hazard analysis. And in this case, you break a job down into tasks or steps. So let's say your job is you're an electrician, but your task today is to change out a faulty light switch. Well, what are the hazards if you have to think about that are associated with that light switch? Everything from lockout, tag out, the proper tools, everything you need to do the job safely, right? So what you're going to do is you're going to take that task and list every step that has a potential exposure to it, write it down, write what the potential hazard is, and then what kind of controls you're going to put in place to mitigate that. So if your hazard is electrical shock, make sure you're following proper lockout, tag out processes and procedures. Make sure you're wearing insulated gloves, have the proper tools, those kind of things. And so that's how you go through. So you can take anything from, the reception desk at a hotel has some hazards, so potential exposures to people coming in the door. store. So, you know, what are those hazards? What are those steps? And then what kind of controls are we going to put in place? Whether it's a plexiglass shield, limiting the number of people in the vicinity, proper spacing, face mask, PPE, you know, different types of things. So that job safety and job hazard analysis can be done on a very simple form that we see here. And on the left, you sequence the steps. In the middle, identify hazards. And then on the right, identify what procedures, processes, or controls you're going to put in place to mitigate exposure to those hazards. And I would suggest you do that even outside of COVID. This is a great tool to use in all areas of your business to identify potential hazards. And when you do these, it's important to save them, keep them as a record. That way, somewhere down the road, if you do have some sort of an incident and you have to have some conversation with a compliance officer or insurance companies, you have documentation. Hey, here's the steps we took, here's the controls we put in place, and you've done what you call your due diligence as part of your planning. And the thing is, if you don't do this and you have an incident, then you don't have a lot to defend yourself with. So this is really an important step in order to make sure that you're identifying those risks and finding ways to mitigate them. All right, the next thing we want to do is develop a plan. We want to have some sort of a plan on if we do have an exposure. And at this point, I'll let Amber kind of take over and she'll go through the next few steps.
All right, thank you. So to kind of tie in what Ed's been talking about, the first few action items that he mentioned was if you don't already have a team, develop a team. A team's going to be important. Again, it gives you coverage from all different departments. You know, when you're in upper management, sometimes we don't necessarily see the challenges or the constraints that maybe a certain department or other, you know, frontline workers see. And so it's super important to have that with these response preparedness plans. So I've heard them called all different things. I've heard infection control, disease preparedness and prevention. So either way, whatever you want to call it, we need to have a plan specific to how your organization is going to handle infectious disease responses, right? How we're going to prevent it and what we're going to do in return in case if there were a case. And so if you get an employee that comes to you and says, hey, you know, I think I might have been exposed, we absolutely need to know what we're going to do ahead of time. So a couple of things that I want to talk about. There's some references, OSHA, there's some current programs that you can refer to in regards to, instead of reinventing the wheel, I know some organizations have bloodborne pathogen programs, things like that. So if you're starting from scratch, again, that SAFER link to that Ed mentioned through the National Safety Council, they've got some good plans. There's a lot already out there. So don't reinvent the wheel, but definitely you want to customize it. You want to make it visible to everybody. Again, Ed mentioned using tools such as a job hazard analysis. Either way, whatever tools you use, make sure you're looking at all of your operations. You want to make sure that you're not leaving anything out. Ed will mention a little bit later as far as an action item, reviewing from a customer perspective, right? So sometimes with these plans, we get so narrow focused because we're the ones writing the plans, whether it's a team or we're doing it by ourselves. Oftentimes we might miss things. And so that's a part of when you're developing these plans, you want to look at all the different factors. Ed, if you'll hit the next one for me. So when it comes to infection protocol, this is key. I often run into a lot of clients will call me and in almost a panic, you know, Amber, I got this weird case, or Amber, you know, so-and-so didn't want to come to work today because so-and-so was possibly exposed, and there's all these different situations, and some of them can be quite unique. I still, to this day, the calls have definitely gone down, which has been great. I don't get as many calls on a weekly basis, but, you know, there's still some of these odd random things that are happening. And so in your protocol, you need to know ahead of time, what are we going to do, what we're going to do. So there's actually a great document at the end of this presentation that you guys will all have access to that kind of gives you some examples on how to respond. And I absolutely recommend that you at least have a, if you don't have one, if you do, go back and take a look at it, see if it's working, but an infection protocol. And what I mean by that, you can see I've given you a few examples, but what is going to be your protocol for somebody who's considered primary exposure, right? So I have an individual who has been confirmed diagnosed with COVID-19, and I want to talk really quick about the confirmed. Have procedures on how you're going to confirm. In my personal experience in working with numerous clients, I'm still seeing a lot of false positives. I'm seeing individuals who went in, didn't necessarily get tested, but were reported positive. And so there's still a lot of that. There's still some gaps in the system. So you want to make sure that you're confirming, where did they go? Did they get a doctor's note? That kind of information, because that'll put them in that primary category. And based on that, you're going to have different procedures on CDC guidelines, what we do. So do we quarantine this individual for so many days until after tested negative? You know, you need to think about that ahead of time. And then from there, trace contacting, right? Who were they exposed to? What did they contract it at home? Did they get it at work? Were they exposed to other workers? And so that's it's kind of like a hierarchy. You see down in the secondary, this is a team member who might have been in direct contact with somebody, but not a primary, right? So there's going to have different infection protocol. I know some employers were being super proactive at the very beginning of this and just shutting everybody down if there was a potential exposure. However, that really wasn't conducive to business, and CDC doesn't recommend that as well. So make sure that you kind of follow this hierarchy of charts, understanding what the difference is between primary, secondary, tertiary exposure, and what your protocol is going to be based on that. Next, let's see if we can get to that next slide. There we go. So next, again, talking about your plan. Now, those of you who've already done this, I realize that some of us have maybe already started this. I do want to recommend with any plan, you know, not just COVID, but any plan that we're doing, it's always good to go back and look and see what's working. So whether you're starting over and this is the first time you're hearing it, or this is the first time that you're hearing this, it's still good information. It's always good to go back to the foundation. So when you've got your team, you've kind of evaluated all of your exposures, all of your risk, and you're putting your plan on paper, start with this upside down triangle. This is a basic framework that OSHA and a lot of safety professionals refer to called the hierarchy of controls. And it's super important that you understand. I'll go through each one of them fairly quickly so that we can keep this moving. If you have questions at the end, you can ask or email me, and I'll get into it more specifically with ideas. But I just kind of want to give you all a general idea of how this works. So this upside down triangle, you can see if you start at the top, these types of controls are going to be more effective. We have elimination. So there's things that we could possibly do to eliminate the exposure, right? That might be keeping workers at home, staggering shifts, certain screenings, things like that. And then as we go down that triangle, those controls, while good, and sometimes we can combine with other controls, they become less effective. So I want to point at the bottom of that triangle, we see PPE. PPE we refer to in the safety world as your last resort. So when you've done everything else that you can and we implement PPE, we need to understand when PPE fails, injury or illness is the result. And so it's super important to not start with PPE. Oftentimes when I work with employers who are putting their programs together, we tend to want to jump to PPE being our first control. So I want to point it out, it's super critical to have an effective plan that's going to work. Start at the top, not at the bottom. So again, on the hierarchy of controls, we have the engineering controls, which I've kind of skipped down. We have the elimination substitution, but engineering is going to be kind of where we're going to start at. and the control. So engineering involves isolating employees from work-related hazards. So the reason these tend to be more effective over administrative and PPE is because we're not relying on somebody to do something. These are solid controls. They reduce workers' exposure, but again, we're not relying on worker exposure, or excuse me, worker behavior. So like you can see in this picture, we've got a physical barrier. We are isolating workers away from potential exposure. There's nothing that the worker needs to do. It's at their station. So a few other examples can be things like increased ventilation, high efficiency air filters, maybe touch-free faucets and receptacles, reconfiguring workspaces to promote distancing. Again, these are all on that pyramid. These are up there and tend to be more effective than your last line PPE because we're not relying on worker behavior to implement those. Next, we have the administrative. I want to actually skip to the next slide because I believe I have some more examples of that. No, okay, sorry, let me go back. I apologize. So again, administrative controls, these, when we can't engineer out the hazard, we will take a look at administrative controls. These require action by the employees or the employer, and they often include changes in work policy or procedures. So it might be things like working remotely or staggered work hours, safe work practices, programs on, again, that infectious protocol. That's an administrative control. It's a program what to do. If an employee calls and thinks that they're sick, what are we going to do? That's kind of a control there. Travel procedures. You know, Ed mentioned, hey, I traveled a little bit. So National Safety Council has procedures. What happens when a worker travels? What are we following the CDC guidelines before they can return? Do they have to quarantine? That type of stuff. In here, we'll also see your disinfecting and hygiene procedures, which I'll talk a little bit more about later. Signs, right? When we have a plan and a program, it's important that we remind our workers through signage, and we communicate parts of our control strategies through that. And then also in here, we see education and training. If we want to get buy-in, you know, regardless of what we all think, everybody, in my experience, I have seen so many people, we all have our own personal opinion on COVID. Your workers have their own personal opinions as well, but we need to eliminate that. If we want to get everybody to buy into our program, whether they believe it or not, whether their personal opinions, we have got to communicate and train them effectively on, look, this is our plan. This is why we've chosen in these certain engineering controls, these certain administrative and PPE controls. This is why we've chosen this type of glove versus this type of face covering. You need to train. That is going to be key. I'll touch on it a little bit more later. And then lastly, again, PPE. This is your last defense. So I often recommend with your plan, whether you have one or you're just establishing, take a look, find out what's effective. I still am seeing, you know, now that everything's open, being I call myself a safety nerd, I constantly have my safety eyes on. And so when I visit other employers and businesses, I'm taking a look at their strategies. Some companies, bravo, are doing an excellent job, whereas I'm seeing a few others that are struggling, and their controls, it seems to be that they're jumping right to PPE, and oftentimes they're choosing PPE that they're not even educated on how it works themselves. We see in this picture the N95 respirator, and a lot of employers I've seen just jump to that and not knowing that bringing in an N95 respirator, mandating that workers wear it, you're now subject to additional OSHA regulations under the respiratory protection standard. There's certain fit testing and medical evaluations that are required. I'm also seeing these N95s with the excess flow valve. It's got that little square box in the front of it. That flow valve is designed to allow excess air to come out, and so it's not quite effective for COVID. I'm actually super glad I saw an airline ban those, which was bravo to them for doing some research. But my point being, do research. Like Ed mentioned, in the beginning, look at the industry, see what other companies are doing, but make sure that you're educated. Don't just jump to PPE in your plans. If you're currently using PPE, take a look, go back and see, is it effective? If we're using gloves, right? So gloves are a one-time use. Are workers using them all day long? What are the potential exposures there? So when you're developing your plan, use this hierarchy of controls, but I can't stress it enough. I've been out this last month. I've been out with OSHA a lot. They are out. They are definitely on COVID. They are responding to complaints, employee complaints. You need to, as an employer, make sure that you have a plan that is documented and that it is effective. So while we're going to give you a ton of resources and kind of the skeleton and the bones, you need to, as an employer, tweak it. You need to make it your own. You need to get other people involved, and you need to use certain controls that are going to work within your vicinity. All right, Ed, I believe I'm handing this back over to you.
Yes, and we want to talk a little bit about the medical and health aspects of this, because we're seeing a lot of different things used, from temperature checks to actual testing required, contact tracing, questionnaires that you fill out before you go into an office. For example, I went to see my dentist about a week and a half ago, and I had the temperature check and the questionnaire I had to fill out. Have you been exposed? Have you traveled to certain places? Those kind of things. And so a lot of places are using these sorts of different test things. What you have to be aware of as an employer, if you, for example, doing temperature checks on your employees, it is allowed under the current COVID crisis that's been identified, but you also have an obligation to protect that medical information that you're obtaining, because the temperature check is considered a medical exam under the ADA, which means you cannot disclose what that person's temperature was. So if you're standing, hey, you're 98.7, you can't say that out loud to where other people would hear it, because now you're disclosing temperatures and medical information that should be private. So be aware of those kind of things. And hygiene and infection control, break it down to the basic safe behaviors. Encourage people to wash their hands frequently, avoid non-essential contact, have remote meetings instead of in-person meetings, have proper PPE scaled according to what the risk is, add sanitizing stations everywhere. I just came back from a trip to a resort, and anytime you entered any different room, the first thing you have to do is use sanitizer on your hands. So we're doing those kind of things much more frequently to make sure that we're doing everything we can to mitigate the spread of the virus. Here's a sample form that could be used. And the thing about this form, if you ask any of these questions individually, you could potentially violate ADA. However, if you ask a group of questions together like this and say, hey, are you able to answer yes or no to all of these without identifying which one, then you can ask those types of questions, as long as you're not disclosing which of the questions that they cannot answer affirmatively to. So these types of forms are being used pretty frequently, certainly more on the medical side of things. If you go see your doctor, your dentist, chiropractor, whatever, you're going to see a lot more of these types of forms. Some businesses are also using those. When we hold classes here at the Safety Council, we have a similar questionnaire that we have people fill out. And we tell them, hey, if you're not feeling well, if you have any of these potential symptoms, then please reschedule to another time. We just want to make sure everybody that's here is safe, right? So let's talk a little bit about the emotional and mental health side of things. And this is where we're seeing a lot more attention being paid to now. Starting back in March, April, May, when people were physically quarantined at home, businesses were shut down if you were working or working remotely. And they found that, yes, all of this can be workable, but there are side effects to isolating people. And we're seeing, as a result now, here we are 6 months into this pandemic, and we're seeing a much higher rate of drug use, substance abuse, mental health issues, depression, um, domestic violence even is happening. So we're seeing a lot more of these types of side effects that take a while to be identified. And some of them are very, very serious, such as substance abuse and domestic violence, but others are a little bit harder to identify. Something as simple as I'm having trouble focusing. My sleep schedule is a bit disrupted. I'm waking up in the middle of the night and I'm kind of stressed out, or I'm just kind of feeling off, and I'm not motivated. I'm kind of numb feeling. And these are all side effects of isolation and not having the interaction with other people that we're used to having. Because even if we are back at work and we are in our office, we still have procedures in places where we have to wear masks and we have to limit our contact with other people. So even if we're back in the workplace, it's not like it used to be. And those changes are sometimes difficult for people to accept. So we want to really, as employers, be really laser focused on trying to identify these sorts of effects in our employees and encourage people to get help. There's no shame in asking for help. We can all use help at some time or another. I know there's been times where I'm saying, I'm done with this. I just want to move on and get back to whatever normal is going to be. But finding out that normal isn't normal. And so it's not unusual to have these sorts of feelings and frustrations and making it difficult to focus. And all those can affect our job performance and can affect our safety on the job if we're doing items that are potentially dangerous. So another thing that we want to do, our next action item, is have some sort of training in place. If you were away and closed and now you're returning to work, have it like it's the first day they've ever been there. Have some sort of orientation where you discuss the changes in procedures. Talk about how the virus spreads. And by the way, that particular topic has evolved since this all began, right? In the beginning, we were really, really focused on surfaces and touching things, as well as the droplet spread. And recently, the CDC is as they've learned how this virus spreads, they've kind of changed their priorities. And yes, we still want clean surfaces. Yes, we want to disinfect as much as we can, but they found that transmission is actually a bit lower than what they originally anticipated. And they're more focusing on droplets and airborne kind of spreads. So this is a constantly evolving process, and we need to make sure that we're specifying protection protocols that are going to match the current information. Amber wants to
yeah, I just wanted to chime in on the training. Again, the orientation is great, but I recognize some of us have kind of already been out this. And so it's, again, going back to, and we'll touch on communication, but training is key and it's constant. I want to point that out there. Training is constant, even to your trainers. I worked with a business not too long ago in which, they had their program together, but the people that were training and the supervisors and managers that were putting it on, they didn't really buy into the program. And so maybe look at that. Your team, they need training as well. Ed talked a lot about mental health, and that is huge. That is the trends. That's kind of what we're seeing and dealing with. So as an employer, that has to be factored in there. So when you're putting your training programs together, while the initial training program is great, communicating that with your workers as far as what we're doing, but it's a constant. That's what I want to point out. Changes in those procedures, like Ed mentioned, there's changes in, again, how the virus spreads, CDC protocol, there's even changes in the ADA and all of that stuff. So you need to make sure that your team is constantly training and communicating this information so that everybody, all employees from top all the way down to frontline, understand, and that will help with buy-in. That's going to help with some of the fear, some of the what ifs, because again, while we're going to these things and we're going to credible sources, you have to recognize that your workforce is still exposed to everything else out there, social media, all of that. So how do we get a good, effective program? Training is key. I cannot touch that enough. Thanks, Ed.
Awesome. And that training also includes the PPE, how to properly use it,
Absolutely.
how to fit it, how to clean, how to
Yes.
dispose of.
Yes.
So you're right. The training is critical, and it's not a one-time thing. It is an ongoing process. And you know what? It was prior to COVID, and it will be after COVID. Training
Absolutely.
is always an ongoing process. We do need to talk about cleaning and sanitizing. Yes, the CDC has downplayed a little bit the surface contact aspect of this, but it's still important to do. So start with a clean facility. If you have to get a professional in to identify the proper cleaners for the types of surfaces and areas and the contacts that you're going to have, certainly do that. The EPA has an approved list of disinfectants. It's their EPA list in. We'll have a link for that at the end of this. So that's a really good resources, but keep in mind also, if you're introducing new cleaners and chemicals into your area of business, you also have to practice safe procedures on how to properly protect people against those, how to dispose of them, how to use them properly. So have those safety data sheets available and educate people. That's part of the training process on how, not only here's the cleaner, but here's how to use it. Amber, go ahead.
Yeah, being again, the safety side of me's got to kick in here. So I'm currently working with a client who's facing this issue. So you need to make sure you have your hazard communication programs written and up to date. And this is kind of falls in the line on the OSHA side. While we're still trying to sanitize and protect, like Ed mentioned, you are introducing new chemicals into the work environment. And so those safety data sheets are key. However, take it another step. You need to make sure it's implemented into your HAZCOM programs and that you're thoroughly training your employees on the exposures and access and all of that. So thanks. That's all I want.
Awesome. All right, safe practices, and some of these kind of get back to the basics. You know, stay at home if you're sick, if you're not feeling well, if you have a fever, if you're feeling kind of off, frequent cough, those kind of things. Maintain social distancing, hand washing. We're hearing this constantly, right? Almost to the point where it's kind of, almost not effective because we're just so used to hearing it, but it's really important to keep doing this. Proper coughing and sneezing etiquette into your elbow, into a cloth, into tissues. Make sure you're trying to, collect as many of those droplets as you can at the source. Avoiding, non-essential contact, handshakes, hugs, those kind of things. Avoid having in-person meetings, do them remotely. Don't share items back and forth. And then once again, the proper PPE such as masks and gloves.
Ed, really quick, there was a question that came up in regards to action item 7. If you could touch on, there was a question, how often should we be sanitizing? A classroom per se, something like that. Are there recommendations from the CDC as far as, before and after? What do you recommend when it comes to sanitizing efforts?
All right, so something like a classroom setting, like where Amber and I are sitting now, we have people that come in for a number of hours at a time and then they leave, and we're sanitizing in between every use in that case. So one person sits at a table, they get up, they leave, we clean and sanitize that chair and tabletop. If you're in an area where you have like walk-in clients and you have a counter surface or door handles and things like that that are frequently touched, it's going to depend on the volume, but you want to create some sort of a schedule where those are done maybe every 15 minutes or once an hour, depending on the volume. I was at my doctor's office a few weeks ago, and there was a guy in there doing nothing but walking around, wiping down door handles.
Yes.
Now, something you can possibly do if you don't need that door to be closed,
Yes.
let's leave it open, right? That way we don't have a surface point of contact. So there's no actual answer for how often you clean things. It's going to depend on the frequency of use and the potential exposure. But where you can in between people, you should do it if you can.
And you nailed it. Again, going back to OSHA compliance and protecting worker, health, that's kind of what they're looking for. If you ever, an OSHA compliance officer comes to visit your facility, that's what they want to know. They want to know the whole program. What are you putting in place? What type of engineering and administrative controls, PPE, that kind of stuff. And so they want to see that. Do you have a cleaning schedule? How often? Ed mentioned it is always best before and after. Sometimes that can be a challenge challenge. And that's where it's important to have a team of people to take a look at this and put a program that is effective. I'd love to put on paper that everything gets cleaned constantly, but that can, let's be realistic as well. These plans have to be realistic. It has to be something that's doable. And so, again, it's not I wish, like Ed said, I wish there was an answer that's a one size fits all, but it's really not. You need to take a look at your environments, look at the exposure, the risk, and then put something, a plan that is going to be effective, then it's going to work. All right, so I'm actually going to take over onto the communication side of action item number 8. I've kind of touched on this a little bit already, but it's super important. Again, you've got your program, whether you're just starting or you're going back and taking a look and making, adjustments as you go along. It is key to have a consistent message. That starts from top management. Again, I can't stress it enough. Get everybody on board. Your trainers, your supervisors, have a meeting with them. Get rid of all the personal opinions, all of the false information, and just look. Here's the deal. We have to protect our workers regardless. And so everybody needs to be on board. That message needs to be consistent, and it needs to be positive. So take a look, especially if you're the one in charge of this. Do a walk around, see kind of what some of these messages are. I challenge you to see if there's some of that negativity going around, and let's bite that in the butt, right? Let's deal with positive. We as an employer are doing what it takes to make sure that everybody goes home safely. We want everybody to buy into this program. We encourage input, and definitely make sure you're leading by example. Start at the, look at your supervisors, look at everybody and see, do they buy in, and find out if they don't. If they don't, what is it? Maybe it's because we're not effectively communicating why we're choosing a certain control, why we're using social distancing, or we've restaggered and reconfigured the workstations instead of jumping right to PPE. Well, maybe it's a little bit of education. Maybe your workers don't understand. They're thinking that, hey, I'm safer if I put on an N95 versus if I socially distance. Well, there's a gap right there in some education and training. So share your commitment, communicate your efforts, why you're doing what you're doing, and again, encourage input. That is going to be huge, because we're seeing, like I said, Ed mentioned a little bit earlier, especially with the school shuts down and all of that, we're starting to see fear and a lot of that mental stress and financial burdens. And so it's important that this program, whatever it is that you do, is communicated positively throughout your whole organization. I believe action item number 9 is building trust with customers, which I'm going to give over to Ed. But before I do, really quick, I saw there was a question I want to hit on really quick. A question came up earlier. If I had an employee test positive several months ago, can I ask them to be retested, all of that? You need to be careful. You need to be careful. If you do not have a written plan with protocol, you're walking a fine line by just kind of reinventing or coming up with procedures as you go. Ed will mention, he's kind of mentioned a little bit. I know there's more information at the end in regards to EEOC and ADA regulations, but you really have to be careful. So in that instance with that particular person, I would challenge it, go back and have a plan. If you don't already have one, follow those procedures. Again, going back to that kind of, if they've been primary exposure, secondary exposure, what are our procedures? Get it written down. Make sure all of your workforce is educated and trained on it first before you start implementing anything. While I do need to acknowledge there is some potential risk if you had somebody a few months ago that was tested positive. However, that case, you need to gather a little bit more information. See where they're at now. Again, get your program together and then deal with that kind of individually, but be careful with just kind of on the fly procedures is where I'm going with that. That's why it's super important. Talk now. If you haven't had any cases, if you've had a couple things, talk now. Talk now about extreme cases. What happens if I get 4 workers from an apartment that call in all sick one day? What are you going to do? It is important to talk now and have those plans in place. So, all right, Ed, I'm going to give it back over to you.
Awesome stuff, Amber. And these are really, really important issues. And I can't stress enough, like Amber said, you can't make this stuff up as you go. You really need to plan it out. And if you have, for example, asking for a negative test before they return to work, if that was your policy that was in place for everybody, then you can legally do these things. But if you haven't done it before and you just decided at this point, hey, let's do this now, You have to make sure you're documenting and make sure you do everything appropriately so you don't violate any of the ADA and EEOC laws. Okay, so with all this, we're trying to build trust, not only with our people, but with our customers. So we want to be visible with cleaning and safety. In the past, like a restaurant would be kind of discreet when they cleaned a table after some. Now we want to be visible and say, hey, here's what we're doing. We're sanitizing, we're doing this, we're doing this. Have up front in your lobby, have posters as to what your plan is. Use effective signage. And let people know that you are truly concerned with their safety and you're making that your top priority, and here's the things that you're doing. I encourage you to walk through your front door of your business like you've never seen it before. Be a first-time customer, walk in and look around. What do you see? Because you're used to coming every day and you're kind of oblivious to what's there. And you walk past things that are potentially hazards all the time. But if you look at it from the perspective, this is my first time walking through the door, and take a really careful look around, do I see countertops with handprints and fingerprints that are really visible? It means, well, we haven't disinfected anything in a while, right? So look for those types of things and use those as opportunities to evaluate your facility from a different perspective. We've all seen YouTube videos of people getting in fistfights in stores because of masks and because of different things. Somebody asks a customer, hey, can you please do this? And the customer's defiant. Do those things discreetly, do them outside the store, do them in places, because the last thing you want to be is a YouTube sensation with 1 million views, right? Those are not helpful for you, for your business, for your customers. And if you are using social media, use that effectively to convey the message, hey, here's the things we're doing, and we're being proactive about these things and trying to help keep people safe, right? So use that effectively. Lesson learned, we're going to take a few minutes, and this is where we're right before the Q&A part. So let's kind of, if you have any final questions, but we're going to kind of go through some of the lessons that we've learned as we've gone through this. First of all, and we've said this about a dozen times, planning is critical. And planning is an ongoing process, not just make a plan and let it ride for 6 months. You evaluate that plan, see what's working, what's effective, what you can do better. And because this isn't going to be the last pandemic, there's going to be others in the future. So this is a great lesson in not only planning for today, but planning for what's going to happen next week, next month, next year. The other thing we've seen, especially from CDC, and some people use this to be critical of CDC, that the guidelines change. Well, in March, you said, don't do this. Now you're saying do this. Well, the CDC is evolving as we learn a lot more about the virus, and you would hope that they would do that. The fact that some of these guidelines change is a good thing. It's not an excuse to be critical of CDC or OSHA or anybody else. It's the fact that every day we're learning more about this particular virus. So the guidelines have to change. And so from your standpoint, it's really super important to be flexible and try to stay on top of those changes. One of the things they've emphasized a lot the last 60 days or so is there's a lot of people with COVID-19 that are positive and exhibit no outward symptoms. So we have to be aware of that as well. Just because everybody feels normal, looks normal, they can still potentially have the virus. So we have to be diligent in, once again, a good mask policy, distancing policies, because you simply don't know who has it and who don't. We talked about the disinfecting surfaces. Yep, recommended. We still want to do that, but we're placing much, much more emphasis now on the droplet and the airborne transmission aspect of this disease. And so that's why masks are much more critical than they used to be. And proper etiquette and sneezing and coughing and speaking and, those types of things are much more important than they were. And then we also want to keep in mind, and we touched on this earlier, the mental health issues, substance abuse increases, effects of unemployment, effects of financial difficulties, effects of isolation. There's a lot more of these mental health issues that on every level, from just minor I can't focus today to all the way from suicides are up. So we need to make sure that as employers we are really relating to our employees, having communication with them and asking, hey, how you doing today? Are you okay? Is there anything I can do to help you? I want to make sure that you're safe and healthy in all aspects, not on the physical, only on the physical side, but on the mental side of things. Are there any concerns you have? You know, engage in dialogue and have communication with people to help identify those. Amber, do you have anything to add based on what you've observed with your clients?
No, again, I think I've already hit on it, and I know we're running out of time, but again, for those of you that have already been open and are doing this, go back, take a look at your plans, look at what's working, make sure you're getting feedback, because again, like Ed mentioned, we're seeing a lot of new challenges with the schools and different things, and so communication is going to be key. Training, keeping that message positive. So it's important to go back. I tell anybody with any program, any system, we start from the beginning, but you constantly need to assess it. Go back, look and see what's working, what's not, what's feasible, where we may be getting bottlenecked, and then implement new ideas and challenges. Again, the OSHA website, the SAFER website, great resources out there for some of you who, whether you're starting brand new or kind of going back to look at your programs. Ed just put up some links we've referred to throughout this entire slide. I believe they're also going to be on the Arizona Commerce website as well. So if that's about it, if not, I think we're at the Q&A. We have a few minutes for questions.
Yes, thank you, Ed and Amber. For attendees, if you have any questions, please drop those in the Q&A box real quick. We got a minute or two we can take for those. Also, if you notice on the screen, you've got Amber's and Ed's contact information. A few of you had asked about that through the chat box, so that information is listed on this slide. So, yeah, great presentation, Ed. Amber, thank you very much for sharing these updates and sharing this information. And I totally agree. As we learn more, things are going to change, but it's for our better, so we can help keep everybody safe. I don't see any questions popping in. So with that, I'll reach over to Ed. Ed, do you have any closing, or Amber, have any closing thoughts as we wrap this up today?
I just want to thank everybody for allowing us to spend some time with you, and hope you found the information to be helpful. And certainly please feel free to reach out to Amber and myself if you have any questions. Amber, anything else you want to add?
I want to say hang in there. You know, I applaud everybody who's here today. Obviously, you know, we're wanting to do the right thing. We're wanting to make plans. Again, I've been working with so many companies, and I can see the frustration. I can see the pressure. I want to say you're not alone. Hang in there. I often tell so many clients, day at a time, you know, start with a plan. So I applaud you for attending. Again, thank you for allowing me to join Ed today. And you've got our contact information if you have any questions. Thank you so much.
All right, thank you, Amber. Thank you, Ed. We appreciate it. We want to throw a quick reminder out for a Thursday morning session, 9 a.m. with APS. Please go to the website and register for that. It will be a very exciting session with, again, a brand new tool that for data that is normally available to large companies and is now available for small Arizona businesses to take advantage of it and learn how to use it to grow their business. So a great session we're looking forward to on Thursday. Please sign up. Again, great session today. Amber and Ed, great job. And thank you all for attending, and we will see you on Thursday. Have a great day.
Thank you.